Diabetes training for nurses. Diabetes is a disease where the body doesn't produce or properly use insulin. Insulin is a hormone that is needed to convert sugar or starches in other food into energy for daily life. Type 1 diabetes, the body does not produce insulin. Insulin must be injected by a syringe or infused through an insulin pump. Type 2 diabetes, the body does not use insulin well. Diet and exercise can help. Some people with type 2 diabetes require oral medication. Some people take insulin or a combination of both. Common factors. The goal is to try and maintain blood sugar levels at near normal values. Diet and exercise play a big role in taking control of blood sugar values. And differences. Type 1 diabetics will always need insulin. This patient or student may have to test blood sugar more frequently than those with type 2. In type 2, good exercise and diet may change the need for medication. A type 2 diabetic may test blood sugars less often than those with type 1. Hypoglycemia is classified as blood glucose less than 7 milligrams per deciliter. When blood sugar gets below a normal range, it needs to be treated right away. A person may feel shaky, weak, sweaty, disoriented, or confused. A person may not have symptoms and still have hypoglycemia. Test blood sugar if you feel at all different from how you normally feel. You as in your patient. If your student or patient feels different than they normally do, please check their blood sugar level. Emergency glucagon administration. If a diabetic student is found unconscious, delegate someone to call 911 immediately and prepare to administer glucagon intramuscular injection. Prepare glucagon for injection. Remove the flip-off seal from the bottle of glucagon. If possible, wipe the rubber stopper on the bottle with an alcohol swab. If not available, that's okay. Step 2, remove the needle protector from the syringe and inject the entire contents of the syringe into the bottle of glucagon. Step 3, remove syringe. Shake the bottle gently until the glucagon dissolves and the solution becomes clear. Glucagon should not be used unless the solution is clear and of water-like consistency. Using the same syringe, withdraw all of the solution from the bottle. This will be approximately 1 milligram or 1 milliliter or 1 cc. Cleanse or wipe the injection site with an alcohol wipe if available. The injection site can be on the buttocks, arm, or thigh. Choose an easy access site. You do not have to remove clothing to inject glucagon. Therefore, an alcohol wipe is not mandatory, nor is exposed skin. Insert the needle into the loose tissue at a chosen injection site and inject all of the glucagon solution. Hold the syringe like a dart. Insert the needle straight in and push the plunger. There is no danger of an overdose. Apply light pressure at the injection site and withdraw the needle. Turn the student into the recovery position, which is his or her side. When an unconscious person awakes, he or she may vomit. Turning the student on their side will prevent choking. If the student awakens and is able to swallow, give him or her a fast-acting source of sugar, such as a regular soda, not diet, or orange juice. Follow 10 minutes later with a long-acting source of sugar, such as crackers and cheese or peanut butter. Assist the paramedics as needed if they have arrived. If the student does not awaken in 10 to 15 minutes, give another dose of glucagon if 911 has not arrived. Even if glucagon revives the student, he or she needs to be seen by a physician. Document the incident. Hyperglycemia is high blood glucose, greater than 240 milligrams per deciliter. Untreated high blood sugar can cause both short-term and long-term complications. Untreated high blood glucose can cause ketoacidosis in people with type 1 diabetes. This is a medical emergency and must be treated at the hospital. The symptoms are having high blood sugar or glucose, nausea, vomiting, cramps, dehydration, or listlessness. Ketoacidosis can lead to a diabetic coma. Mild hyperglycemia left untreated leads to many complications associated with diabetes. They include heart disease, high blood pressure, retinopathy, neuropathy, nephropathy. Emergency procedures. Glucagon is an emergency medication that is given by injection when the person is hypoglycemic and unable to take anything by mouth. The person may be slurring, unresponsive, or unconscious. After injection, turn the person on their side, again that recovery position. Contact district nurses for training on medication administration. Call 911 immediately. Here are some examples of how to calculate insulin dosage based on glucose goals and the health plan provided by that student's provider or endocrinologist. Pause here to review and practice. Here are dosage calculations for carbohydrate coverage for meals and snacks. Again, please refer to that student's provider or endocrinologist health plan. Pause here for practice. Please understand that the steps to medication administration are extremely important, and errors can lead to serious injury and possible death. If you have any questions or are unsure about administering medication to students, contact your district nurse prior to giving the medication. We can set up another training at a separate time or additional one-on-one training.